Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my boards exam, and this led me to found SPT with Me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our courses at sptwithme.com. Now for what you're actually here for, let's talk about what is a bursa is a structure within our body that essentially is a sac filled with fluid, and the purpose of the sac is to provide cushioning and decreased friction in areas of movement or significant movement. So think about areas like tendons, areas between tendons and bones, between muscles and bones, and even between skin and bones. Every single time that you move, there's going to be friction in those areas, and a lot of friction ultimately can cause pain. But with the structure of a bursa between those two areas in which there is friction, it can help reduce the amount of stress that you might have felt had there not been a bursa in place to provide that cushion and provide ultimately less irritation. Even though the job of a bursa is to handle friction and is to handle stress, a bursa can only handle so much. And when it can't handle anymore and it's irritated, it can lead to something called bursitis. The reason why we feel pain from a bursa is because bursas themselves have sensory receptors, so they can feel pain. And when we feel pain, what happens is that information is sent to our brain telling us that something is wrong in that area. What can cause bursitis? Let's talk about the lesser common causes first. Well, if you fall and land on an area that has a bursa, it can cause pain. Again, it has sensory receptors, so if I fall and land directly on a bursa, it's going to tell me that it hurts and that you've damaged the area, depending on how severe it is. It's going to result in inflammation. Again, because you've damaged it. Inflammation, to a certain extent, is normal because that's the body's normal way to heal itself. But the severity of inflammation and the duration, so how long that inflammation lasts for, that's where it starts to get a little bit tricky with respect to inflammation itself. Rheumatoid arthritis. This is an autoimmune disease that directly causes inflammation to structures in our body that have synovial membrane. What we often associate rheumatoid arthritis is with joints because it has a synovial membrane. So every time that someone moves their elbow or their knees or their hips, they feel pain. And that's because there's inflammation to that synovial joint. The bursa also has a synovial membrane. So rheumatoid arthritis also affects the bursa directly. Well, the suffix of itis is inflammation, bursitis, right? The suffix itis. Inflammation of the bursa. That's exactly what bursitis stands for, and it can be directly caused by rheumatoid arthritis. Gout. This is another type of inflammatory disease that can result in a direct effect to a bursa. What happens with gout is that crystals form, and crystals with respect to the bursa, they can actually be deposited inside the bursa. I mean, that just sounds incredibly uncomfortable to have a hard crystal inside the bursa. So this obviously leads to pain, it leads to irritation of the bursa, thus bursitis. Then one last example of a lesser common cause of bursitis is something like an infection from bacteria like Staphylococcus aureus. If you have an infection from that, it can make its way towards the bursas and cause inflammation directly to them. Now going on to the most common cause of bursitis, which is things like overuse. Like I mentioned before, the bursa's job is to be a cushion and serve as a gliding surface. However, just like other structures in the body, it can only take so much. What you need to understand is that a bursa is unlike other structures in the body. Muscles, you can strength train them to get stronger. Tendons, you can train them to get stronger. Bones, you can have an effect on the bone density. A bursa, you can't really do much to improve how much a bursa can handle. But what you can do is work on what's around the bursa so that the bursa does not need to take so much friction, does not need to cushion so much for that area. This obviously goes into the treatment section, which we will review later. But the most common cause of bursitis is due to repetitive use that ends up aggravating that bursa because you're just moving that joint or moving that muscle or bone over and over and over that bursa to where that bursa just can't take it anymore. And this could be someone who was sedentary and they just started picking up a sport like tennis, so you're serving 40 times a day now, maybe even more. It could also be a high-level athlete who's been pitching over 100 times a day, or really however many times a day they do that every single day. So bursitis can really happen to anyone. To be able to treat bursitis, you have to know what the cause is first. So on the previous slide, I talked about the lesser common causes, which include, an infection from bacteria, having rheumatoid arthritis, having gout. Now, if a person came up to me as a physical therapist and I see within their chart that the reason for their bursitis is because they have an infection from Staphylococcus aureus, as a physical therapist, how is me showing them how to move their shoulder or how to squat or strengthening certain muscles going to help the fact that they have an infection? It's not. So this person would actually have to go to the doctor and treat the infection directly that's affecting their bursitis. Now, as a physical therapist, and you come in and you have bursitis because you recently started bowling a lot or golfing or playing tennis a lot, whatever it is, and that's how you got bursitis, that's when I can help you. So I mentioned this before. A bursa is not a structure in your body that you can control directly. I cannot just tell my bursa to contract. It's not something like a muscle. So the only thing that I can do to not only treat bursitis, but also prevent bursitis from happening is by addressing the cause of it. And what I mean is not so much for you to stop playing tennis, quit golfing, quit bowling. Instead, what we should be doing is taking a look at the surrounding muscles of that bursa. If those muscles are not strong enough, what happens is that every time that I lift my arm, those muscles aren't helping with reducing the amount of friction or the amount of stress or the amount of force that that bursa endures. So the idea is we need to strengthen the surrounding muscles of that bursa so it can help to reduce the amount of stress, reduce the irritation that that bursa feels. Going off of that, muscle strength deficits can thus be the reason for bursitis, and ultimately that's what we would treat. We would try to get those muscles stronger. But it could also be the way that we move. For example, let's say that our humerus, or the long bone of my arm, is rotated inward too much. It's internally rotated so much to where every single time that I lift my arm, I'm just compressing all of the structures in my shoulder. And that is ultimately going to result in a ton of irritation to my bursa because that also happens to be a structure that can be compressed if I move like that. What if we changed and altered the mechanics of how our shoulder moves so that we can, instead of internally rotating, externally rotate our shoulder so that we can put the shoulder in a more neutral position as we're bowling or as we're golfing and making all these repetitive movements. And a change in the movement pattern can result in less irritation to the bursa to allow that bursa to heal. So it could be a strength issue. It could be a motor coordination issue. Flexibility can also be an issue too. If I have some muscles that are too tight and some muscles that are on the opposite side of the spectrum where they're too loose, this causes an imbalance of a joint or a structure. And any imbalance can provide too much tension or too much laxity to where that bursa still experiences a lot of irritation. So flexibility is also a concern, or the lack of flexibility. So here's the thing. Realistically, after injuring yourself, whether it's a disc in your back, a muscle injury, a tendon injury, bursitis, whatever it is, our pain from those likely starts to spread into other areas. My shoulder hurts because I started a new sport and I have bursitis. And because of that, I'm likely not to want to use my right shoulder. And that's because it hurts. I know people just power through pain, but do you realistically think that even if you're someone who just powers through it, that you're using your shoulder just as much as you were using it prior to injury? The reality is likely not. We don't like to experience pain, obviously. If I don't use my shoulder as much, though, because of this, my muscles start to become weak. My tendons, as a result, become weaker. I slowly get less bone density because I'm not using that arm as much. My muscles are also going to lose a bit of flexibility since I'm likely not pushing it to end range motions because it hurts. So as you can see, one injury can lead to other secondary issues which can cause further pain. So what I want to tell you is that if you have bursitis, you will also likely have a myriad of other symptoms as a result because of the bursitis. And as a result, you will have to stretch some muscles. You'll have to strengthen some muscles, and you will have to work on how we move the body so that it doesn't hurt as much as we allow that bursa to heal. So realistically, you likely, depending on where in the body that you're talking about, the shoulder, the hip, the knee, it doesn't matter, you'll likely have so many symptoms that you will have to address all of those in your treatment. So how do you actually treat it? Understand this before continuing to listen to me. The best way for you to address bursitis, if it really is something that a physical therapist can help with, remember if it's an infection, not necessarily, the best way you can address it is to actually go to a physical therapist. That way they can see you. They can see if it's truly flexibility that matters, if it's strength, if it's coordination, etc. But if you do not have a means to see one, it's because humans tend to have a general trend of how we end up moving after an injury that we can almost assume which muscles we need to strengthen, which muscles we need to stretch, and which movements we should avoid. That way we can make exercises and see what might just be the best for you to start implementing to address bursitis. Now, there are about 160 bursa in the body. So what I want you to do is check out my other videos for specific exercises on how to treat bursitis in specific regions of the body. If you finally understood what bursitis is and you're studying for the NPTE, check out our courses at sptwithme.com. Check out this reference for more information.